Hello, hello. Welcome to our virtual COVID-19 town hall. How are you? How are you? As the screen reveals, my name is Angela Brown, and I am the grateful executive director of Loving Our Cities. And we have a great team of healthcare experts that are joining us tonight to talk faith, to talk facts, and to talk our future, hopefully a future that is COVID-19 free. Who is ready to move forward? I know I am ready to move forward, and it looks like the region is going to be moving forward. And as we make progress into the future, I think that we are all believing for. We definitely want to be prepared. We want our children prepared. We want our moms and dads prepared, our teachers and our students, our church family prepared. And so we're really excited to have this lineup of amazing healthcare experts to help us to get prepared for the journey that still lies ahead. But prayerfully, we're going to be leaving some things in the past and moving into a new world, but it absolutely is going to be new. We won't be going back to what was. So we need to get prepared for what will be. And we definitely want to make sure that we are resilient and we are ready to not only recover from COVID, but for us to be fully ready for what lies ahead. And so I'm excited to have a new friend who we are able to collaborate with. I want to bring Ellen out, Ellen Magenheim from CAMcare Corporation. How are you, Ellen?
I'm very well. Thank you very much, Angela, and thanks for having us. This has been great.
It's an honor to have you. I'm excited that we are able to have a little collaboration going because, as you know, we've been working hard behind the scenes trying to formalize a collaboration because we've seen how in some cases it's been challenging for people to get access to the right information, first to understand COVID-19 and then to get access to the vaccine. And so we're really, really excited to formally now have a collaboration with CAMcare to not just educate the public. So we're so excited that you are back with your colleagues to talk about COVID-19 and the vaccine so that we can be educated. However, now we can actually bring the vaccine to various locations. And that's what we've been working for. So I am so excited. But Ellen, why don't you tell us a little bit about who you are, and then why don't you go ahead and introduce your colleagues?
Thank you very much for that. Angela, this has been such a wonderful relationship that we've had and grown, and I'm very excited to be a part of it and the changes and how we can help everybody move forward. And CAMcare has just been, that's what their mission is just to get the message out there and get the vaccines in the arms and let everybody have their regular life back. I mean, these year and a half has been testing beyond the beyond, and the ability that we have to pivot is really wonderful. And just to share this and to get the education out there and to get everybody the understanding and the knowledge so that they can really make a wise decision. And it is my honor to work at CAMcare and to introduce to you some of my colleagues that are on today. I have Dr. J.C. Knights. She is our Chief Medical Officer as well as our Clinical Director of OBGYN. There she is. And I also have the privilege of having Dr. Neil Kaplitz, who is also an OBGYN provider who has been there for the past over about 25, 30 years. And I heard that I just got a little note that our Chief Operating Officer, Janet Hunt, is with us today. So this is our team from CAMcare, and it is my honor and privilege to introduce them. So if you'd like to take it from here.
Great. Thank you so much, Ellen. And thank you, Church, for inviting us for this exciting forum to talk a little bit about COVID-19 and the vaccinations. So what we'll do is we'll just start right in to let you know what is going on in the world of vaccinations. Okay, so just a second. Great. So as I said, my name is Dr. Knights, and I am here with Dr. Kaplitz. And we're going to talk a little bit about COVID-19. All of us know at this portion what is going on with COVID-19, the symptoms that we have from COVID-19, including shortness of breath, cough, fatigue, headache, sore throat. What we know about COVID-19, we know that it's an infection caused by SARS-CoV-2, the virus that causes COVID-19, and it can result in a range of illnesses from mild symptoms to severe illness and death, unfortunately. We don't know how SARS-CoV-2 will affect each person, unfortunately. Some people are more likely to become severely ill, such as older adults and people with certain medical conditions. At this point in the pandemic, a year in, we all know that wearing a mask that covers your mouth and your nose works to prevent COVID-19, avoiding close contacts with others if you are vaccinated, cleaning and disinfecting frequently, using a hand sanitizer. Of note, COVID-19, we know now that not everyone with COVID-19 feels sick. So 1 in 5 folks reported no symptoms. This is a map of New Jersey and our COVID-19 cases. And you can see throughout the South Jersey region how we're doing with COVID-19. With our vaccinations, specifically in Gloucester County, I've included some information on that. And you can see we had quite a few folks with at least 1 dose, and we are getting there with getting people fully vaccinated. We know now that the FDA has approved COVID-19 vaccines for emergency use authorization. We have 3 vaccines on the market here in the United States. We have Pfizer, which has been proven manufacturing data to be 95% effective, and that's a 2-dose regimen. We have Moderna, which looks to be about 94.5% effective, and that is also 2 doses. And then we have Janssen, the latest one to the party, and that looks like it's about 63.5% effective against symptomatic disease, and that's a 1-dose vaccine. As of yet, the duration of protection is not yet known, but what we do know is that the vaccines were tested in a diverse set of adult populations, including older adults and communities of color, which is important when we talk about disparities with COVID-19. And I'm going to hand it over to my partner, Dr. Kaplitz, and take it from there.
Good evening, everybody. It is a pleasure to be here, and hopefully we can answer a lot of questions and get a little bit more comfortable with this amazing technology. So this slide reflects the fact that when these vaccines were studied and are continued to be studied, that we were able to determine the efficacy of the vaccines. And in this case, the newest one that was approved, which is a single-dose vaccine, even though it had efficacy of around 65% from preventing any symptoms, it was clearly much more effective at preventing severe disease, hospitalization, and death. And I think that's really important. And I lost the slides. There we go.
See them? Oh, okay.
I can see them again. Okay. So clearly that is important, because the idea is to prevent people from ending up very sick and even passing away from this virus. So it's highly effective at doing that. As you can see, that initially when these drugs were given emergency authorization, they had to have the typical enrollments in trials so that they could be approved for emergency authorization. And you can see both Pfizer and Moderna were able to enroll over 30,000 people. And there were clinical sites throughout the United States with a good distribution of people showing that diversity for its effectiveness. The messenger RNA vaccines are set up so that we get 2 doses. One is 21 days apart, that's Pfizer, and Moderna is 28 days apart. And what that showed was that antibody response and protection by second shot 2 weeks after was reaching over 90% efficacy for prevention of infection and symptoms, which is fantastic. There were no significant safety concerns for messenger RNA vaccines. There were some rare allergic responses, which were easily treated. None of these patients who had allergic responses were severely ill and required extensive hospitalization. The vaccine timeline was what some people perceived as rushed, was actually getting rid of the red tape part so that the companies could present the data as soon as possible. And the number of people enrolled were exactly the same as any other vaccine that has ever been approved by the FDA. The hesitancy is something that we're really concerned about now because we have this amazing technology, but we know in the information age that many people will go down the rabbit hole of reading material that's not scientifically based, and they'll be very fearful about, well, this is a brand new technology. Could this harm me? Are there side effects? How safe is it? Luckily, does it cost anything? This is what's great about the initiative throughout the world is that the cost of this vaccine is covered by the government. And we know that people, when they have good information and they have people that they trust, will be more comfortable with getting vaccinated. So the Janssen vaccine is different from the other messenger RNA vaccines. The reason why it took longer to approve, it's a more conventional vaccine using the same technology that's available in other vaccines, such as Merck's human papillomavirus vaccine. And what it does is it actually uses a virus that people get infected with that doesn't make them sick. And they genetically engineered that virus so that cells would produce antibodies. Now, this next slide that I'm going to discuss with you is about this scare that people had that put J&J's vaccine on hold. And the scare was that there was some rare clotting events that occurred in a host of people. Actually, the total was 14. And then initially the concern was for 6 women that had this rare clotting called thrombocytopenia syndrome, where platelet counts dropped and people had some clotting issues. What I like to tell people is, though this has occurred, this is not the first vaccine that it has occurred on. All of the vaccines that share this adenovirus have this rare syndrome, and it's roughly 1 in a million people. So it's a very, very small part of the population. Some other exciting things are children are now being vaccinated. As of May 10th, enough children were studied to show that not only is the vaccine really safe for children, it reaches 100% efficacy so that children can go to school, they're protected, the teachers are protected, and they can go back to normal lives, which is what we all want in this COVID world. We want to get back to a little bit of normalcy. The Pfizer approval and soon Moderna, and I'm sure J&J will be approved as well, had 2,260 participants through the ages of 12 and 15. And they had the usual side effects of vaccination. Their arms were hurt, they were a little tired, a little fatigued. They may have had some muscle pain or chills. Some of them had fever and joint pain, and all were showing a good response to the vaccine to protect themselves. COVID-19 vaccination is in approval by the FDA. The key top priority is to make sure that it's safe for people to get. And the safety standards are the same for all vaccines. And before they were approved for emergency authorization, data had to be reviewed, and it took 7 to 14 days for the committees to make that decision that there was enough data that the safety was clearly evident and that giving that emergency authorization would protect people. The vaccine works because it tells your immune system to make antibodies to a particular part of the virus. there's a robust response. People make lots of antibodies, and it helps to prevent us from getting ill, getting severe pneumonia, ending up being very, very sick in the ICU, or even dying from this vaccine. When you get vaccinated, you're doing something that's extremely important. I think from a humanistic standpoint, because when you vaccinate yourself, you're preventing yourself from infecting other people. And we know that if you get infected and you spread it, they spread it, you may not realize that you've infected somebody who gets very, very ill simply by moving down the chain. So the more we vaccinate, the more we get herd immunity, the more we're protecting everyone, not just in the country, but in the world. This is a tool. This is vaccination is a way to take a world stressor event that has had major economic impact and has affected the lives of all of us, so that we can all protect ourselves, stop spreading this COVID-19 around the world, get back to work, get back to our normal lives. Vaccination is that measure to prevent that from happening. Now, there's another interesting question that people have. Well, I don't need to get vaccinated because I had COVID-19 already. Interestingly enough, there's lots of literature that shows that when people make antibodies to their COVID-19, it doesn't last very long for some people, and they can get reinfected. What we know about the vaccine right now is after 6 months of both messenger RNAs, the amount of antibody protection is still robust and it's still protective. So we know that even people infected should be vaccinated because it helps them from getting reinfected. And that's important. So when a person wants a vaccine appointment, we encourage people to read up and learn about the vaccines. See if you're the question of whether you were eligible now has opened up, so that if you're over the age of 12 and you're interested in getting vaccinated, you can get vaccinated. When you're at the visit, we'll give you a fact sheet that goes through some of the major points that the CDC wants people to know before they get vaccinated. You can talk about your health conditions. You can ask us questions. Once vaccinated, you'll get that magic card. It's going to open up the door to many events, get you on an airplane, etc. We'll also give you an appointment if you're getting messenger RNA for your 21 or 28-day revisit. After vaccination, you might notice that you have some side effects. There are many apps that you can sign up for to enroll about the safety, about how you're feeling, and the idea is once vaccinated, of course, we still recommend continued protection. However, we know that guidelines are now changing about mask wearing on vaccinated people. Vaccination, it works. Vaccination keeps people healthy. Vaccination has been showing, Johnson & Johnson especially, that it's standing up to these variants, these mutations that are occurring, for example, in South Africa and in South America. People who are vaccinated do not make a lot of virus. If they have an infection, they have there's a less chance of infecting other people. It's making the public happy and healthy.
And I just wanted to mention that today the CDC came out and said that people who are fully vaccinated do not have to wear masks indoors. So exciting news and a chance to see life after vaccination. Thank you guys so much for giving us the opportunity to share some information about vaccines.
Thank you both. Thank you, Dr. Knights, for that hot off the press information. And I think that that really is a great point to stress. There has been a lot of hot off the press information. A year ago, right? Our region was ground zero for COVID, and what was thought to be really centered in urban areas, that methodology, that ideology was quickly, right, dismantled as we saw rising incidents in rural communities, suburban communities, like where I live in South Jersey. And so I wanted to bring some of our nurses on screen so we can talk about how they have been on the front lines and what they've seen evolve over time. I'm so grateful that we've had some positive movement forward, but it came with a lot of fight, a lot of effort. And so some of those nurses that were on the front line are some of the nurses that I called upon to ask questions, especially when there was an opportunity for me to get the vaccine. Was I ready? And so one of those nurses that I called that helped push me to the front line with her was Renee Stevens, and the other one is Natalie Pearson. They're my resident nurses, but they also serve as members of the TPC COVID-19 task force, as well as Natalie co-chairs Perfecting Health, our ministry, but definitely people that I have on my hit list. Pick up the phone and call if I have questions. And so I would love to hear from you ladies. Renee, you really have been serving in a rural and suburban community. And then Natalie, of course, you've been serving in a more urban environment. I would love to hear from you. What have your learnings been? What have your experiences been? And I can only imagine you are excited to turn the corner and move forward from this as well. Why don't we begin with you, Renee?
Absolutely. And Angela, I just want to say thank you for having me. I'm excited to talk about this very important topic. And in terms of what I've seen over the past year, well, I've learned from taking care of the critically ill patients with COVID that this disease was unpredictable. It took no mercy on anybody. We saw young, we saw old, we saw Caucasian, we saw African American, we saw people who were doing everything right. We saw people who didn't believe in the virus. And when they got to the ICU, which was the population that I cared for, it was no respecter of person. So it was just an incredible amount of death and devastation to the patients that we cared for, to the family members, to the staff. We didn't have the luxury of seeing the statistics that other people might have been hearing of the 95, 97+% that get the mild case and go home and be okay. I saw the population of the ones that when they came through our doors, their mortality was almost 80%. And those who did survive it were not made whole. So once they left the ICU, they still had a lot of struggles. Even some of the staff that contracted COVID early on, we had nurses who were in their 20s, and one of them today still does not have his taste and smell back. So the devastation that the disease caused was just overwhelming for us as a nursing staff. So I was very excited once we knew that there was a vaccine and there was a way that we could fight it. Because prior to the vaccine, we were doing everything we could, but we couldn't get ahead of the disease. So a few months ago, I work for Jefferson Health System, and I work in the ICU in Washington Township Division. I was privileged to be the first nurse to get the Moderna vaccine in the South Jersey area. So that in and of itself became an experience for me. I somehow kind of became the spokesperson. So I was talking to a lot of people about the vaccine. I really believed in it. A lot of my friends and family who had the vaccine hesitancy in the beginning have since changed their mind. So I believe that this was a success. Forums like this with our town halls that we were having and with the COVID task force, the things that we were doing at church, I think all these things played a part because there was real hesitancy, and we all understand the reasons why. But once people were getting informed information and they were making informed decisions, I think a lot of people changed their minds. So I'm excited to know that the numbers are trending down. Today, our current numbers are in our entire hospital, 13 COVID patients. A year ago, that would have been the entire ICU full of COVID, but we only have 13 in the entire hospital. 30 days ago, we had 35, and in December, we had 75. So we can see that the vaccines are helping, that the numbers are trending down. So in our small community hospital, I think because people have gotten the vaccines, they've already been past their 2 weeks where they are considered fully vaccinated, it's really starting to make a difference in our community. So I'm very excited because as the summer's coming and it's getting warmer, and if more people are now eligible for the vaccine, I think we really will be able to see a difference, and the hard work that we did will finally start to pay off.
So grateful. So grateful that your hard work is paying off. I'm so grateful that you are still well, physically, emotionally, mentally. I can only imagine how taxing it's been. And I'm very grateful that you gave me that gentle nudge and told me to get my vaccine. Natalie, what are you seeing? What have been your learnings, your greatest takeaways, some of your frustrations?
Unlike Renee, I was not in the ICU. I work with patient as an outpatient. And that's what I saw, some of the residual effects of COVID, and trying to convince my patient that it's so important to get it, because I was more afraid of COVID itself, because right now we're still learning the effects of COVID on heart disease, and it's the inflammatory process with it. It's still a learning process. But I've had an opportunity over the last 2 months to give out vaccines. And for me, it was a time to educate the community and to empower them with knowledge so they can spread and bring back to their community. And also, we found that going into the community to give the vaccine was very helpful. Going where people are, because a lot of times there was a lack of access. It was these vaccine clinics, but if people weren't able to get there, and what I heard a lot of was I could not get through to make appointments, or I didn't have the technology to get through. So I found myself helping a lot of my patients to make those appointments. So I think for us, it's very important to go where the people are, because still, even though if I'm not mistaken, like 50% of our American citizens are vaccinated, in Philadelphia, it's still still less than 40%. So it's like 35% of the people are still not only 35% are vaccinated. So that's still a small number. We have a lot more to do, but I'm so excited when I get patients who are vaccinated. And I'm really excited about that. We're learning the long-term effects of COVID, and there are still a lot of myths out there, a lot of false beliefs. And it's so important to educate. And I always say we have to be that role model. We have to be example, and we have to spread the word.
Thank you. That's so true. I want to bring Dr. Knight back out to speak to some of the misinformation that exists out there, like Natalie just mentioned, because there's still a lot more work to be done. Renee, I am absolutely grateful that you gave me that gentle nudge, and Natalie, you confirmed. And then Pastor Kevin literally grabbing me by the arm and telling me we have to get this vaccine, because as a community of faith, right, as community leaders, he was vested in, we need to ensure that people get the right information, but also we need to set the example for them. And so I'm grateful that I was pulled to the front of the lines. Yes, I got the vaccine, and I did not have any negative experience. However, there are some people that have some very real questions, Dr. Knights, that I would love to pose to you. I see a comment from Chrissy Phillips. She says that on the news that they said don't get a mammogram until at least 6 weeks after, because your lymph nodes are enlarged and make it look like you may have issues concerning breast cancer. Can you speak to that concern? It sounds like it's a very real concern, and there's very real misinformation circulating the internet. And so can you speak to some of that? Help us, help us.
Sure. So where we can start is, if you remember in the beginning of the pandemic, what was going around was that COVID didn't affect Black folks, and community and other folks in the communities of color. And that turned out not to be true, of course. Um, Initially, there was information regarding postponing your mammogram for 6 weeks. The CDC put that out initially. They've since backed away from that information, and they do recommend that you talk to your mammogram provider to see if they have any requirements of time between vaccine and mammogram. It does not change your breast tissue at all. It can give you increased lymph nodes underneath your arm, just as you're having pain here, and you can get some pain and swelling here. You can get pain and swelling underneath your arm, which can be seen by a mammogram. But most people are backing away from that advice at this point.
And I think that is so important that you brought up the issue of race as it relates to what some believe to be true and what some believe to not be true, and who it most affected and who it did not affect. There's been so much information, but it also has been a great opportunity for us to reconcile, if you will, with the medical community, because there was a very real history that led to that distrust, but has also made it very, very clear that it's important for us to have a relationship with our own doctor, a doctor who knows us, knows our body, and we can go to and ask questions instead of us relying on all of the information that was circulating back and forth in the internet. So thank you for clarifying that. And I'm hopeful that people now get access, but certainly this has also exposed the very real disparities that exist in healthcare. And so in what ways can we close the gap, if you will, so that we can continue to build trust within our community and those marginalized that perhaps don't necessarily have the trust that they should in the medical community, or they're challenged getting access. They don't have access to healthcare. But as Dr. Neal stated, at least this vaccine, thankfully, is being made available for free. How do we close the gap and make it more accessible and get over those hurdles?
Well, that's a great question. Thank you for asking it. So the first thing is, I'd like to pick up on that point with the understanding that the vaccine is free. So we have a glimpse of what a country with completely paid healthcare looks like, where people can walk in and get vaccinated and not have to wonder whether they're going to have to rob Peter to pay Paul this month in order to afford this healthcare. So the vaccine is free. Free, to mimic the commercial. So you should not have to pay anything. The persons who vaccinate you will bill your insurance if you have it, and then will take it off the top if you don't. So that's the great thing about the vaccine. Certainly the relationship, the fraught relationship between communities of color and the medical community was laid bare in this pandemic. And we have lots of work to do. But one thing that we did start to do is we started to actually talk about it. We started to have frank conversations about where that distrust comes from. Many people don't know why there's a basic distrust in their families that has been passed down generation to generation, and they may not know why there is that distrust. That distrust with the medical community is unfortunate, because it then harms us, communities of color. And so on the one hand, we have to talk and we have to reconcile what happened. We have to understand what happened, why it happened, and we have to make a reconciliation with that. But on the other hand, while that's happening simultaneously, we have to get here and we have to get this care. because at the end of the day, this pandemic is also affecting communities of color more rapidly and more deadly. We are the ones who were frontline workers. We were people who had to go to work, who couldn't telecommute from home. All kinds of things put us at greater risk to get COVID and to also die from COVID. So at the same time that we're talking about distrust and problems, we also need to avail ourselves of this very important technology to keep us on par with the rest of America in getting to the other side of the pandemic.
And the rest of the world, because what this pandemic absolutely has revealed is what affects one of us affects all of us, right? We were not an island. And so it's important for us to get vaccinated, not just to protect ourselves clearly, but also to protect our neighbors. However, I see a question from Shanique Langston. I'm bringing you on screen. She says, I'm fully vaccinated and I got sick. When I received my second shot, I couldn't do anything. So I'm not sure what type of sickness Shanique got, and I'm not a medical doctor, and I'm certain that you don't necessarily want to provide advice in this forum, but talk a little bit about the vaccination and what does it assure us once we are vaccinated?
So for sure, there are, you can get some symptoms after vaccines, most commonly after the second vaccine. So I'll talk about my experience. I thought I was great. And then 24 hours later, I had a fever, I had chills, and it affected me. I was in bed for 12 hours or so. So I had a reaction. And while the reaction sucks while you're going through it, it does tell you that your immune system is alive and functioning. So the reaction actually confirms for you that you are having a response to the vaccine, that the vaccine is doing what it needs to do. These side effects are time limited, they're self-limited, you don't have to do anything about them, it will pass. And you should just know that it's just going to pass. It's going to pass. And
So,
at the end of the day, I'm sorry, one more thing to add. At the end of the day, you will not be hospitalized from that. You will not die from that. You will not pass that on to your family members, and you will not make your family members and your friends and loved ones sick.
So good. So good. So yeah, I feel you, Shanique. And other people, share your experiences with getting the vaccine. Have you been vaccinated? Have you not been vaccinated yet? Why? Talk back. We're a community, right? What affects one of us affects all of us. So we would love to hear from you and see what the impact of your experience. I have something that I heard to be true and don't know if it's necessarily true. You said most people experience the side effects after the second shot. I heard that if you experienced after the first shot, that you likely had COVID and did not know it. Is there any truth to that?
We don't know yet.
Okay.
Not enough data to say. And I believe the other person flashed on the screen and asked, when should we get boosters? We don't have data on that either. The CDC has not stated, but they're looking at that. And right now, 6 months looks good. They're still working on the data.
Yes, there's several questions about should we get booster shots. I also saw a question, and perhaps we can bring Dr. Neal back on because Dr. Neal specifically referencing some of the CDC guidelines. People are asking in response to that, how could it be safe for the CDC to stop the mask mandate when we don't know how long the vaccine protection will last or if we should get booster shots?
So it's a great question. So what we do know is that in 6 months of data, we see that the antibody response that people have has sustained itself. And we know that with antibodies in the system, the same level of protection is there. Now, no one will know the exact duration of when vaccine wanes off and someone would need to be boosted. But what we do know is that when people are infected, the virus over time mutates, it changes. It becomes a little different. And every time it becomes a little different, it's possible that the vaccines that we're using won't have the same level of protection. So both Pfizer and Moderna plan on boosting with a little bit of a different recipe for those variants. And they're looking at a timeline of about a year. Now, they're going to continue to do studies and you let the science really give them the idea of that interval. But my guess is it wouldn't be unusual to think of the COVID vaccine like the flu vaccine, where there might be a yearly booster available with a slight change in the recipe so that we can cover all the new changes in the virus because of its mutating.
Thank you. I see another question from Chrissy Phillips. Are they working on making this vaccine better, possibly making it into a pill?
So if I can say something about that, there is no way of orally taking a medication to produce an antibody response. In the future, we never know. But as of the science, you really need to inject the vaccine so that it can get into the bloodstream directly so that there can be an immune response, so that cells can absorb either the virus vector or the messenger RNA to eventually produce the antibodies.
Fantastic. Well, people are asking questions about their children. And so let's talk a little bit about now the vaccines that are available for children 12 to 15, I believe. So can you, Dr. Neal, talk in more detail about getting those vaccines to our children?
So
I'm sorry. Here's a question from Summer. Is there a difference in a child's body compared to an adult's body, which could cause a more severe reaction for a child? Great question.
Yeah, that's why the studies were instituted. There was a general feeling from the science that we would see that children would respond as well as adults. And actually what they discovered is not only do children respond well, they respond better. They have better immune responses. They have less side effects, and they have almost 100% efficacy. And this is what's really important about understanding a virus in a pandemic. We all can get it. We can all pass it. We all love our children. We know that we want our children to have the normal social interactions that school provides and extracurricular activities. And we want them to stay healthy. And we don't want our children to have asymptomatic infections and then give them to our grandparents, per se, which was one of the earlier concerns. We want to open up the world. We want our children to be safe. We want our children to be healthy. We as parents want to do everything in our power to give our children normal lives and protect them. So the vaccines are as equally effective, if not more effective in children, and incredibly safe. That's what it shows. Children are now getting it. We can see the news is right on top of any adverse events that occur because it's a media savvy thing to do. And since the children have been vaccinated, we're not getting any stories that would give us any concerns.
So how are people accessing those vaccines for the children? Is the same process for adults, or is the rollout going to be different?
So it's the same process. Their doctor, their health centers, there's the county vaccination programs. For example, at CAMcare, we will now accommodate children and follow those guidelines and get them scheduled. And Dr. Knights probably knows specifically how we're going to be doing that with our pediatric population, but we're definitely working to implement getting the children vaccinated as of now.
Fantastic. And so there is a question. I think that this has been a pretty popular question. Adults and children, can you still get COVID after being vaccinated? And can you still pass it to others after being vaccinated? I think we heard you say definitively yes.
Yes, absolutely. So what we know is that nothing is 100% foolproof. But what we do know is that when people are vaccinated and they're infected, they're probably not making the same amount of virus in the air as they would if they're not infected. The other thing is if you're infected and you've been vaccinated and it's been 2 weeks after vaccination, you're probably not going to get sick like you would severely ill. Probably won't need hospitalization, probably won't have signs of pneumonia, probably won't have signs that you need to be hospitalized, possibly ventilated. So even though it's not foolproof, it dramatically impacts the health and safety of all of us to be vaccinated.
All right, I want to bring some of the nurses back out as well who have also been on the front lines administering the vaccine. I know personally, I had no idea that there were some people that were specifically looking for the Johnson & Johnson vaccine instead of Pfizer and Moderna because they were allergic to the ingredients in Pfizer and Moderna. That was what was voiced to me by someone, but they could take the Johnson & Johnson. And so all of you experts, can you make some distinctions for us as it relates to Pfizer, Moderna, Johnson & Johnson for adults? And clearly, as I understand it right now, the Pfizer shot, I think, is the only one that is approved for use in children, correct?
Yes.
Okay. So can we talk distinctions between those vaccines? Are some allergic to one over the other?
Well, so you don't know if someone's going to have an allergic reaction to a vaccine until you give them the vaccine. Mm-hmm. What we do know is that the Johnson & Johnson is more conventional, and the reports of having allergic reactions are very small. And what we know is that it's a much more common thing to see with the newer messenger RNA vaccines that some people have some type of allergic response. Again, something that's not usually very serious. So that we are thinking that because we have all of these different tools in the toolbox, that if you're prone to having allergic reactions, that it might make more sense to go with a vaccine that's less associated with some common allergic reactions. And that's simply why that's stated. There is not a lot of data and a lot of science behind it. It's more of a common sense thing. But getting a messenger RNA vaccine, because it's the only one available, if you have allergic reactions, is still appropriate.
So Renee, Natalie, what are you seeing on the front lines? What have you been experiencing, administering, caring for people receiving the vaccine?
From my perspective, because the majority of our nursing staff did get vaccines, and we swap our vaccine war stories similar to the person who posted. Mostly everyone had side effects from the second shot. We all got the Moderna. I do know some people who got Pfizer, but the majority of us got the Moderna shot. So it was not uncommon to have some of the side effects that she stated. And I think sometimes the side effects are so severe that the person is mistaken that for a reaction when it is really not a reaction. It's just, as the doctor stated, your robust immune system fighting because it knows that something's there that shouldn't, and it's gearing you up to prepare in case you would get the vaccine. So I think sometimes people might have mistaken that, but I have not heard of anyone who have had an allergic reaction to the vaccines.
And I have to say, I have not, I've given a lot of vaccines over the last 2 months, and I have not seen an allergic reaction. And I gave Pfizer. Pfizer is what most of my coworkers, and that's what I administer, was mostly Pfizer. And just like everyone else, I think the pain of the symptoms is so severe, you forget how short acting it is. When you look back, it may have been, oh, it was only 12 hours, 24 hours. But in that moment, some people really had some really bad symptoms. I was one of the ones that did not have symptoms. So I was very fortunate. In fact, I was questioned, did I really get a vaccine? But I was one of the ones that did not have symptoms. And I was very thankful for that. But my husband, he had enlarged lymph nodes. And I saw it's like his lymph nodes was enlarged. I didn't want to tell him that, but I noticed. But in 24 hours, it was gone.
Well, Natalie, unlike you, I was down and out for 24 hours. And like the doctor said, I got my vaccine at 2:30. So I went to bed thinking, okay, I have escaped the wrath. I woke up the next day and I thought someone had slipped COVID to me because it was that bad. This is crazy. But as quickly as it came, the following day it was gone. And that's made it so weird that you can be so sick for 24 hours and you can wake up the next day and it's just a bad memory, like a nightmare. So I understand why when people have these reactions, they're thinking that there's something wrong, but there's nothing wrong. And like the doc said, it too shall pass.
Yeah. And then there are people that are having extended experiences, right? Now nicknamed long haulers. Can you speak to a little bit of what that looks like? What distinguishes a long hauler, and what are some things that people can look out for? They are not commenting online, but sending me text where they can't distinguish if it is a side effect of COVID or is allergy season that crazy. People feel like they're having trouble breathing this season in a way that they had not struggled in the past.
Another reason to get vaccinated, and I'm glad you brought this up, is this long hauler syndrome. Long hauler syndrome occurs up to 30% of people who had COVID, even if they were asymptomatic or had mild symptoms and did not know they had COVID. They'd suddenly have symptoms like fatigue, brain fog, moodiness, shortness of breath. And people that are very active and love to exercise find that they have no energy. And it absolutely affects their everyday activities. It makes it difficult to be on the job. It makes it difficult to live their normal active lives. It's mysterious. It's not quite understood. We know that in some people it happens for a couple months and then they get better. Some people are still suffering from long haulers, and it can affect the heart. It can affect the brain. There's some clotting that can be associated with it. Sometimes there are actual tests that can show that there are some changes that occur. Some people get arrhythmias from it. Long haulers is not understood, but what we think is that when the COVID infects the body, there isn't the same immune response that one would get, for example, from being vaccinated. And some of this virus can cause some organ changes. We don't have enough science to know, if this is going to persist. I also saw some interesting information that some who have long haulers who then get vaccinated 2 weeks after their vaccination have diminished symptoms from long haulers. So that's quite exciting to think that by increasing your immune response, some of your long hauler symptoms may get better. So I recommend anyone who has long haulers get vaccinated.
Wow. Here's someone asking a question. I'm not familiar with this, and I don't even want to attempt to pronounce it. So it's on screen for you.
Talk
about that.
Talk about monoclonal infusion treatment for COVID. So monoclonal antibodies are basically they're antibodies removed from somebody who had COVID, and then they're used to treat another patient with COVID. And that has turned into being one of the few treatments that we were able to get for COVID.
Fantastic. And I have a couple questions coming in. People are inquiring really, when is this going to be available for children under 12? But also, here's a great question from Melvin Rowden. Teenagers need several vaccines going back to school or college. How does the COVID vaccine play into getting or not getting a shot, such as M and B, certainly since some schools now require both? Dr. Knight?
Sorry, I was reaching for my mute button. So one of the things that we were concerned about early on is that the CDC had put out a recommendation that you couldn't have the COVID vaccine at the same time or in proximity to other vaccines. I think a couple of weeks ago, the CDC removed that recommendation. So now it's going to be much easier for kids to get their whole slew of vaccines. And I think, moving forward, I think what we'll see is this is just one of the vaccines that you get on your way to school. That we all do for our kids. So, yeah.
In many colleges now, to get back into class throughout the country, and it's starting to spread, are requiring vaccination before their students can go back. So, there is vaccine hesitancy, but people sometimes do what they have to do because they're forced in doing it. And we would never really want people to have to feel that way, because we call that the stick, swinging the stick. But we're starting to see that is happening as well, that colleges and possibly even our public schools and some of our private schools may eventually require vaccination, again, to protect all the students and the staff.
Yeah, I see a lot of people that are primarily saying that they had the vaccine and essentially had positive experiences, just a little bit of soreness. Some had, the 24-hour, but this person is voicing that they did experience brain fog. So I don't know if there's anything that we can specifically do to combat or reverse some of those. I definitely want to make sure that we allot time to talk to Dr. Chuck Morris, my favorite fitness expert, who really has worked with a lot of professional athletes. And I think that you've worked hands on with people to help them recover from injury. Man, the whole world, Dr. Chuck Morris, probably feels injured, if not physically, emotionally, mentally. How do we come back from this? How do we foster resilience so that in the event we are here for the long haul and life as we know it has changed and there is no going back, or there's another enemy? If it's not named COVID-19, perhaps there's a variant or a whole new virus. How do we build up our immune system, not just physically, but also soulishly, spiritually, so that we are resilient, more capable of adapting and overcoming?
Well, thank you so much for the question. And just being here listening to this conversation is so exciting for me, and it's such great information. And the reality of it is, and we can use COVID as an example, and the reality of COVID is it's a virus, and it may, and in many cases, enact a overactive immune response, which causes inflammation in your body. And there's been a lot of misnomers and snake oils, especially pointed to the health and wellness industry, and telling people they don't need to get the vaccine, you don't need to see a doctor, you just need vitamin D, you just need this, you just need that. And I'm going to say this right now, and it's okay, I might get bad mail. I'm Chuck, I can handle it. I promise you that I know more than most people that you have access to about your health and wellness in terms of fitness and human performance. And stop. Don't believe any of these things that are telling you you do not need to have the extra science, medical resources to help your body fight off what it's trying to fight off. What is true that we want to try to get our body in the best condition we possibly can, giving our system all of the things it needs to function optimally. By doing that, we give us a better opportunity to fight off whatever is happening. That is true. The other things where we go off on these rabbit holes, they aren't science-based. It's what we call bro science. I heard, they, but it can't be validated in science, And when we talk about inflammation, one of the things that we can do is just cut back on things that we know inflame our system, not based on opinion, science. Things like dairy, sugar. Let's just pull some of those things away from us, so that when the next thing happens or this thing happens, we have a better starting point and give our body more ability to fight it. And that goes into the mental reality of the stress and trauma of this experience and being locked in and closed down. And one of the things I said to someone we were coaching, and we talked about trauma, I said, think about how stressful this year has been, because your stress response in danger. Well, we believed, and it was true, that the danger was in the air. I can go outside and inhale, become sick, and God forbid, lose my life. That is a high level of stress. Our kids are experiencing it, our teenagers experience it, and we experience it. And we can't glaze over that. We have to be diligent in understanding that aspect of it as much as our vaccine and seeing our medical professionals.
I think that's such an excellent point. And, one thing that I have been preaching to myself repeatedly, someone who is very goal driven, right? And has a to-do list. For me, one of the greatest lessons of the pandemic was to slow down and to practice presence, appreciate my family, right? Appreciate I'm still here, and appreciate the people that I have the privilege of being here with, but also to give myself permission I was in a pandemic.
Right.
Give myself permission to acknowledge that I was going through something, and then care, revere, right? Honor my body that was carrying me through that, as well as my spirit and my soul. And so I can't say that I was always working out, Dr. Chuck.
Hey,
I
wait.
was doing some things that were healthy. I was riding the bike. I was doing a little bit of yoga. I was breathing, but I definitely had more macaroni and cheese than I usually do. I was cooking more.
Right. If you can deal with that, that's okay. That's okay. That's just getting outside and getting sun. We had a conversation with our daughters, and this is what I told my daughters. I said, what's the worst thing that can happen for school this year? This was in the very beginning, schools were shut down. They said, we don't know. I said, the worst thing that can possibly happen is you fail. So what? You'll get to do it again. So we wiped away all of the pressure of school. I said, so let's start with just take all of that pressure away, and let's just take it a day at a time. Likewise, what you said, like you couldn't do everything.
Right. And so I'm going to be patient coming back, but man, am I ready to get my pre-pandemic figure back. And so I'm going to be working out, but also practicing some mindfulness. And so I can't wait to hear from you and Natalie and Renee. I think you got some news for us about an upcoming Spring into Health initiative, but we do have some other questions I want to make sure we get to related to COVID. While we still have our CAMcare partners, because we also have an exciting announcement to Renee make about our collaboration with them as well. And so any forethoughts on this upcoming flu season and the impact on COVID and the variants? How can we prepare well physically so that we can stay well? I think, Chuck, you gave some really great advice, some dietary changes that we can make. So if somebody have some answers to that question on deck, but also there's a question again from Chrissy Phillips. Someone contracted COVID twice. Can you get the vaccine twice if necessary for free? I guess that's what the question is.
So if you've had COVID, I was just going to say, if you had COVID twice, and I think she might be asking, can I get vaccinated after I had COVID twice? Mm-hmm. And the answer is absolutely. Okay. In terms of getting vaccinated after vaccinated, no. What will happen is once we have recommendations and we start boostering, that would be the next shot. And that will be tweaked a little bit for the variants.
All right. Thank you very much. And I agree, Teresa Mangano. Great advice. We want to bring Chuck back. But all of you, why don't we have a fire round, right? Quick. Do you have forethoughts on this upcoming flu season?
So I have noticed, I think we've all noticed that this past flu season was much better than expected. And that really is because we learned how to wear masks everywhere, to wash our hands, to stay away from people. And so all of those things will lead us to probably a better than average flu season this upcoming year, if we remember the lessons of COVID. Yes. All of my girlfriends and I talk about all of the pre-pandemic things that are now nasty to us. Who can think about going into a crowded place and yelling to each other over drinks? Ew. So all of these things have changed in the pandemic, and that is what's going to decrease our flu numbers in the upcoming flu season. My guesstimate, not proven, but my guesstimate.
And get those flu vaccines too.
So get the flu vaccine, okay, and to continue to practice some healthy habits. I'm definitely going to continue to do that as restrictions are limited. Even with the CDC, I still am going to wear a mask. I was already washing my hands. I was shocked to find out how many people were not washing their hands during this pandemic. But I'm also excited to get back to, being out and about and in community. So as some of these restrictions are lifted, what precautions should we take? Yes, practice social distancing, continue to wear your mask and wash your hands. Any other precautions? Flu vaccine, according to Dr. Neal.
I think, Angela, that we should function at our own comfort level because those of us who have had the vaccines, we're feeling comfortable, but there's still another subset of population who didn't believe in the vaccine, who didn't have the vaccine. And like we talked about earlier, you could be in a congregate setting with a group of people who could still be infecting each other. So you just, the 94 to 95% effectiveness that these vaccines are saying, we still can potentially get it, even though the risks are very, very small. But I think as your comfort level dictates what kind of social settings you're going to be in, that's kind of how you should manage your life. And I think, it's good that we're going to be outside. It's going to be warmer weather. All those things are going to be to our advantage. But I think the greatest thing we can do is to continue to try to educate those who have not got their vaccine yet and figure out a way to get to this population who doesn't see the importance of it, because that's really going to be the secret sauce that's going to break the back of the virus. If we, really want to move to the other side, we have to get the people vaccinated who still are hesitant or for whatever reason don't want to have it done.
Thank you. Yeah. Dr. Chuck, any thoughts from you?
Yes, I think something that sounds silly or basic, that's amazing, is actually sleeping. In this high stress, keep everything on, pacify myself, the more actual sleep we get, the stronger our immune system is. The more sleep we get, the more we can process and handle stress. The more sleep we get, the more we can handle what's required when the sun comes up. So something as simple as creating a routine that allows you to decompress and go to sleep. I'll take that before I worry about what you're eating right now.
Yeah. I'm not so worried about what I'm eating. I'm taking my time. I'm being patient with myself, and I'm being kind to this body who has carried me through this pain. I have gotten back on my bike, slow and steady, but I definitely have some snacks in my pantry that I did not keep.
Well, don't worry.
For the pandemic.
We have the event coming up. We do,
and I knew you were going to talk about it. So how can we spring into health, Dr. Chuck, Renee, Natalie? Tell us about it.
Yes, so the COVID Task Force, in partnership with the Perfecting Health team, we're putting together an event. It's called Spring into Health. Now, listen, everybody relax. We're not going to beat you up. It's a fitness party. The entire objective is to give you the tools, the steps, and create a social experience of fun to slowly become active again, right? To slowly ease in to becoming active and combining the COVID and our health. So we're going to have 3 events, and don't worry about the days. We'll remind you. We'll put it out there. But the first one is going to be May 22nd. It's a Saturday. It's 8 in the morning. We're going to get out there. We're going to have a good time, and we're going to ease you through and give you wonderful things. We're going to do it again June 12th and then June 26th. But as always, the Perfecting Church and Loving Our Cities does not just talk. We are of action. So on June 12th, we will also be hosting, in partnership with CAMcare, our first vaccination clinic. So we're going to have a fun workout in the morning, and on that same day, we're going to have our first of our ongoing clinic in partnership with CAMcare, our partners here tonight, with our first vaccine clinic. So we're going to help people get the shot. So that's going to be on June 12th. Angela, you're on mute, ma'am.
I broke the rule. We needed a drum roll before that. As well as our partners on screen. So thank you to Dr. Knight and to Dr. Neal, but also to Ellen Magenheim, who helped us bring this together. So it's easier for people to access. One thing that I learned from the one vaccine workshop that we hosted, 200 people in a day signed up and came out. And so, number one, it was about access. People just wanted to know, how do I get to and just get through all of the hurdles of getting there, but then also trusting their community, right? And wanting to get access to the vaccine so that they could be back in community. So really grateful for the partnership that we are now going to have with CAMcare. And so stay tuned. We'll have some details coming out for you soon on how you can register for the Spring into Health. I'm calling it a fitness boot camp. Anytime Dr. Chuck Morris, I don't care. Anybody who has a mantra, I like it, I love it, I want more of it. You know you're in for a challenge, but it's going to be fun. It's always fun with Dr. Chuck Morris, and I'm so grateful to have CAMcare coming alongside. So perhaps Dr. Chuck is going to give us a boost that we need so that we can get moving again and feel mentally, emotionally, physically healthy. And then CAMcare Ellen, they're going to be there to give us the vaccine.
Absolutely. If there's an arm, we'll shoot it in. It's great. That's the goal, just to make everybody healthy. And I just think that this is great. And we really appreciate the partnership and getting together with you and being able to get all of our communities safe and vaccinated and have the opportunity to ask the question. So I think that this is great, and I can't wait to be a part of it. So thank you for bringing CAMcare in.
Yes, absolutely. And thank you for your yes. Thank you for your yes. I have a reputation of asking people to do things and don't respond well to no. And so thank you for your gracious yes, Ellen.
I always say yes, and we'll figure it out later. So I spoke to our team as we were doing this. Wonderful. This was a great Zoom meeting. So I thank you for that. And actually it wasn't Zoom, but thank you. And they were all jazzed up about this. So this was wonderful. And I hope that with everything that's going on, we can't wait to be a part of it. We're excited. We look forward to it.
Thank you. Any closing thoughts or questions? I see Michelle Green is commenting. She is going to be first in line. I see it. Always ready to be challenged. Coley looks like he's excited. Yes. Thank you. Thank you. Thank you. And this was great. Yes.
Angela, I just want to add one more thing. I want to remind everyone not to forget to reconnect with their healthcare providers. Have put our generalized health on hold during COVID. Now it's time to reconnect if you have not already done so.
That's fantastic advice. Yes, Natalie.
And just what? Oh, go ahead. I'm sorry.
Were you going to say something?
I just wanted to let them know that with what everybody's been going through, CAMcare has been out there also offering our behavioral health professionals that can really help with some of the questions and the feelings that people are going through right now. This has truly been a pandemic and has affected everybody. So, I mean, that's something that CAMcare has been, we've really blown out that program. So if that's something that you could do, I'm going to say yes. So
I'm grateful.
That's body and soul. The same with Dr. That's the same with Dr. Chuck. So it's just going along those lines, body and soul.
Yeah, I'm so grateful. Showing up on the front lines. You're meeting people where they are. So thank you. Thank you, CAMcare. Any other closing thoughts? Dr. Chuck, Renee, Dr. Neil, Dr. Knights?
I do want to say this before we go, that we're excited about June 12th is going to be the on-site TPC first clinic in partnership with CAMcare. For anyone that needs to get it before then, which is also CAMcare, all of their facilities, they currently have the Moderna. And Ellie, you can correct me if I'm wrong. Not only can you walk into their facilities and get the vaccine, but they also have an evening time. I believe it's from 5 to 8 p.m., which interesting enough has been challenging. Most of the vaccination places are in the middle of the day. So if you have work, there's been a challenge. So I believe that you guys have the Moderna and it's available from 5 to 8 p.m. as well. Is that accurate?
Yes, that's correct. We have the Moderna as well as the J&J currently in stock. And that's what we've done for a lot of the teachers, getting them back into the classrooms as well as the students 18 and older. And when you come down to CAMcare, you'll be able to come in with the parents. And this way they don't have to take off from work and we could do them from 5 to 8. So the way I see it is after we make the providers have their long day, they come on down and we just have a vaccine party. So and they've been very accommodating and seeing, as you could see tonight with Dr. Kaplitz and Dr. Knights are volunteering their time as usual. And they're just going to stay online until the last question is answered. And that's what they do at our clinics too, until the last arm is stuck.
Fantastic. And I do have one last question, and I can always count on Jill Iovino. I think that this is a great closing question. She comments that she has a loved one that isn't willing to get the vaccine. I do too, Jill. How do we recommend to them to change their mind? How can we help people? I know this CAMcare partnership is going to help people get the vaccine, the information, as well as literally come on site to get vaccine. But for our loved ones in Virginia, out of state, how can
Our
we help
pedi-
them?
our pediatrician colleagues have great data regarding vaccine hesitancy, right? And families with kids who don't want to be vaccinated in general. And so lots of the data shows that hammering people, yelling at people, shaming people, it doesn't work. And I know for those of us who believe in the vaccine, sometimes we feel like we want to just grab folks and say, just get it done. But that doesn't work.
Yeah.
So information, support, understanding, why do you feel this way? Understanding the barriers and really having it be a communication is much more effective and has a greater chance of changing minds.
I agree.
Kindness and empathy goes a long way.
Kindness and empathy. Yes, you're preaching. Kindness and empathy goes a long way. And absolutely, we can pray for people, right? That is a power position and something all of us can do. In addition to all of the amazing tips and counsel that you gave us tonight, we can absolutely pray. We can absolutely pray. This has taught me that unseen realities like this exist all the time, right? Communities of faith believe unseen realities exist. Unseen enemies exist as well, as this virus has taught us. However, we have our faith, and we have science. We have the medical community. So we live by faith, but we also can benefit from the medical community, science, to help us overcome it. They are resources for us to overcome. And so I don't think that this was unusual in the sense that there are threats like this that exist all around. So we should not have to live in fear, but we should be informed, and we should get access to the resources that we need to overcome. And so thank you to all. I agree, Rolanda. This was amazing information. I agree, Verba. I know you also work in healthcare. They did an amazing job. And so thank you, thank you, thank you. Round of applause wherever you are. Give them a round of applause. Thank you so much for your time. And we're very excited about our partnership. People are asking, do they have to register? Yes, you'll have to register because we are still going to be cognizant, but those restrictions are being lifted. And so while we have trained ourselves to register in person as well as outdoors, those numbers are going to lift dramatically. But honestly, registering, I've loved because I know who's coming now and I know who to follow up with, right? It really helps me better engage. It's really, really been good for me from that perspective, to really be present and not take people for granted and not assume that people are okay. And so I really have enjoyed registering people, seeing people's names, getting to know people more in detail, and really pausing and asking people, are you good? Are you okay? So I won't ask us to close out in prayer, but I would love for us to close out with a deep breath. Dr. Chuck, can you just give us a taste of this? You said you're going to be merciful. It won't be a boot camp. So give us a taste of what we are going to experience as we spring into health with you, as well as CAMcare. We're going to get our vaccine for those that are ready, Dr. Knight. Dr. Neal, we're going to be kind and gentle and have conversations with them to help us understand why they're not ready. But in the meantime, we're going to put them over into Dr. Chuck's hands, and he's going to take on the
So this is easy. This is how we tell our brain and tell our nervous system we're okay. This is a de-stressing or stress management tool. Really easy. We're going to go in the nose and out the nose. So we're never going to open our mouth. We're going to inhale, breathe in for a 4 count. Breathe in. 4, 3, 2, 1. Hold for 4, 3, 2, 1. Blow it out. 4, 3, 2, 1. 4 seconds in. Hold for 4. Blow out through 4. Do it about 4 or 5 times. It helps your sympathetic and parasympathetic nervous system calm you down to let you know you're okay. So breathe, breathe, breathe. Look at you.
All right.
And out. If you feel like you want to pass out, just lay your head to the left. When you pass out.
Now, this is one workout I could do.
Yes.
That's my plan.
One breath at a time. I love it.
One breath at a time. What
That's
a
it.
great closing remark, Ellen. One breath at a time. Let's pace ourselves. Let's be patient with ourselves and patient with one another. But man, do I miss hugs. I'm so grateful for Zoom and this hybrid world that we're living in that keeps us connected because of technology. But I so look forward to coming in person with so many more people that I miss. It's just seeing and loving and hugging. But until then, let's just be patient, pace ourselves, and breathe. Have a good night. Thank you, everyone.
Thank you very much. Thank you, Angela, and Perfecting Church for all of your help. And we look forward to the partnership. This is going to be great.
It's going to be great. Always down for loving our cities.
That's right.
Have a good night.
Good night, and thanks again to everybody. Thank you.
Somebody told me that they had given up. Sick and tired of the way the pressure's getting tough. Nowhere to run and hide. Fighting hard to stay alive. How can it be? Why is it me? I just wanna burn up and cry. There is a purpose for your life. He can always be. Don't give it up. Hey, it's gonna be. God's gonna make a way. You just gotta. It won't last long. It's gonna be. God's gonna make a way. You just gotta stay strong. It won't last. It's gonna be okay. Yeah, yeah, yeah. The tests and trials, they come to make you strong. Keep your head up, don't you let up, and keep holding.